Okay, so here we are in COVID land. You can tell by our masks, we're still wearing them. And what we tried to do prior to these injections is make sure that everyone is COVID negative. Even though I've been vaccinated, we ask our patients to get a COVID test before they come in. So let's see what we can do for her. So she's 30 years old, and we're going to take out some of these wrinkles for her in the muscle tone, which is kind of strong. So can you raise your brow? And you can see here, these are the wrinkle on the forehead, and we're going to fix that up, the frontalis muscle, and then squeeze your brows together. And we have two little muscles here, one on each side, procerus and the corrugators. We're going to take that out. So we'll mark this and do it. It takes maybe over 5 minutes, and we'll do that now. Okay. What I like to do is to mark the areas I want to inject before. So we'll do this first. So can you bring your brow together? And that's a good healthy muscle because she's young. So the attachments here, and bring your brow up. Okay, and now relax, and now really hard your brow up, up. Good, okay. So what I try to do is to minimize the brow distortion, because one of the complications of this is the brow dropping if it's too close to one of the nerves, and the same thing over here. So we'll clean it up and we'll get ready to start. On some patients we put a topical anesthetic. It takes the sting out of it a little bit, but it's really not too bad. So we'll do this now, and we'll start, okay? Okay, right. Okay. If you could right brow up, please. So I just go into the muscle. We don't go deeper, not to get into the bone, and it's very controlled. Put a little pressure on. Good. Okay, good. So now we'll get these muscles over here, and the key here is to avoid the nerves that will drop the brow, which is certainly a complication of it. So I'll pull up gently. Now wrinkle your brow together, please. We'll get the tail end of the muscle here. Get the front end of the muscle here. Okay, good. Okay, and do the same thing on the other side. Bring the brow together, please. Good. And now we'll get the procerus here. And we're all done. So we'll clean her up now. We have a little alcohol, please. A little pressure on gently. And sometimes there's some bruising for a couple of days, and it's hard to avoid that. It takes usually 3 to 4 days for the Botox or whatever we use, neuromodulator, to kick in. And we tell patients, of course, if there's any asymmetry, after 4 days to come back and we'll make an appropriate adjustment. Pretty simple. Not too bad? You all right? Still breathing? Okay, great. We're now about a week after the injection of the Botox, and the goal here was to have some movement, not totally paralyzed, and make it natural looking. Okay, so let's see, can you raise your brow? You have a little brow movement, it's good, and all these wrinkles on the forehead are gone. Not too, it's good.
Thanks.
The price was right, huh?